Well, we all know that regular exercise and a proper diet is the way to lose weight, but for some, it's just not enough and may need to consider other options. So joining me now to talk about weight loss drugs, they're very popular right now, we have Dr. Amanda Cox. She's a weight loss surgeon with Lewis Gale Physicians. Welcome to the show. Great to talk to you about this.
Yeah, thank you.
I think everybody I know knows someone on one of these drugs.
I know, they're very popular right now.
Yeah, and they're working, it seems.
They are working,
Yeah,
yes.
so let's dive into it. So
Yeah.
do these drugs work for everyone?
So these drugs, the newest class of weight loss medications, which are the ones people are most familiar with right now, which are the GLP-1 agonists, and in some case there's also a group called GLP-1 and GIP agonists. So this is the Wegovy, the Ozempic, the Zepbound, the Mounjaro. So these drugs are definitely the most effective class of weight loss medications that we have right now.
Okay.
They work to decrease hunger, to keep you full longer, and they actually work to stimulate the pancreas to release more insulin so your blood sugars are better. So they definitely work for the majority of patients.
Yeah, I was going to ask you how they work. So it sounds like they really do suppress the appetite then.
They do, and one of the ways they do that is by delaying the emptying of your stomach. So when you eat, your stomach stays full longer.
Okay.
So you stay full longer between meals.
Okay, all right. So let's talk about some of the side effects that people are experiencing.
So by far the most common side effects of the weight loss medications are gastrointestinal side effects. So you have things like nausea, vomiting, diarrhea, or constipation. That's what most people see. The serious side effects are much more rare, but they include things like pancreatitis, kidney injury. There's a slightly higher risk of certain type of thyroid cancers, and there's also a higher risk of blindness in patients with diabetes.
Okay, all right. So some things to think about. Let's talk about seeing a lot of people lose weight.
Yeah.
Pretty fast.
Yep.
I mean, are they really effective, and can we ever get off of them?
Yeah. So the studies of how much weight people lose with this medications, they look generally at patients that have been on these for about 70 weeks. So we're talking like 16 months. On average, patients can lose, if they're combined with diet and exercise, patients can lose 15 to 22% of their body weight. So if you were 200 pounds, you could lose 40 pounds on these medications over the course of 16 months.
Wow, that really is life-changing for a
Yes.
lot of people.
Yes.
All right, let's talk about some of the things that people need to know. Who is a candidate for this?
Yeah, so insurance companies in general do cover these medications, but you would need to talk to your individual physician about whether you qualify from a weight standpoint and from a comorbidity standpoint. So for example, if you have type 2 diabetes, in certain instances, you're more likely to be covered.
Yes.
Yes.
Okay. But if I want to lose, say, like 20 pounds, can I take this drug?
It depends what your starting weight is, honestly.
Okay,
It totally
all right.
depends what your starting weight is. So if we talk, when we talk about weight, we talk about body mass index, which is your height divided by your weight. So if your body mass index is below 25 and you want to lose 20 pounds, it's very unlikely that you will be able to get this covered by your insurance company.
Let's talk about women for a minute. If they are wanting to get pregnant, what do they need to know about these drugs?
So these medications are not safe in pregnancy, and it is actually recommended that you discontinue the weight loss medications 8 to 12 weeks before even trying to get pregnant. So if you are of childbearing age and you are interested in taking these medications, you really need to be using a reliable form of birth control.
Okay, good to know. All right, and then also I do want to know about if I can't take this drug, what about other options?
Yeah, so a lot of patients either can't get it approved by insurance or have to stop the medication because of side effects. So what happens when you stop the medications? You know, medications in general don't work when we stop taking them. So we don't expect medications for other chronic conditions like high blood pressure and diabetes to work when patients aren't taking them, and it's the same thing in this case. So most of the studies are showing that within a few months of stopping the medications, people are regaining the weight.
Okay.
So if you are not a candidate for these medications, or you have to stop them for other reasons, then really bariatric surgery, which is a type of weight loss surgery, which alters the stomach, and in some cases the intestines, might be the best long-term option for you.
Okay, all right. So definitely talk to your doctor because
Correct.
there are options out
Correct.
there.
There are very good long-term options, and in fact, bariatric surgery has the best long-term data for resolving type 2 diabetes completely and for prolonging life.
All right. Great information. Thank
you.
you so much, Dr.
No
Cox.
problem.
We
Thank you for
appreciate it.
having me.
All right.